So let's start with the women who fall into the kidney deficiency category, and we're talking about egg quality. This is going to be the main, or the majority of the women that you see. So these are women. These are women who are often in their late 30s. No, Nick. Yeah. These are women who are often in their late 30s or even early 40s. There may be those women who are depleted by decades of overwork. And if they've already attempted some IVF cycles without success, then they will have heard from their specialist that it's an egg quality problem. This thing called egg quality is mentioned in very hallowed terms in the IVF clinics because it's somewhat unfathomable, and it's seemingly beyond the reach of the IVF specialists and the scientists. It's a fact that some ovaries age more quickly than others, and it's also a fact that neither acupuncture or Chinese medicine or anything else can actually increase the number of eggs left in the ovary or change the integrity of the chromosomes in those eggs. Nobody can change that genetic material because, as you know, the genetic material in the eggs has been present in those eggs since that woman was born, or since she was a developing baby. But there's more to the egg than just the DNA. And it's in the consideration of those other aspects of the egg that we hope we can apply some influence. So the environment that the eggs will be occupying in the ovary during their lengthy maturation, which is up to 9 months, has an impact on the shape they're going to be in by the time that they're ready to ovulate, by the time they're mature. What they need then is a good blood supply. We'll talk about whether we can help with that. They need sufficient oxygen. They need adequate amounts of the right nutrients. That's why we will be talking about you'll be talking to your patients about diet. They need the right hormone signals, and they need the capacity to supply enough energy to the embryo. So all of that's got very important implications for eggs that are coming from slightly older ovaries, where the AMH might be a bit low, and possibly it's got important implications for eggs coming from women with endometriosis and PCOS, where egg quality is also compromised. Now, the question we need to ask ourselves is, can Chinese medicine be used to rejuvenate some of these egg characteristics? Maybe by improving delivery of oxygen and nutrition to the developing egg, maybe by enhancing its capacity to make ATP, and thus make more viable embryos. There's some evidence to say it can, so I'm just going to run you through the evidence that we have. If anyone wants the references for these, they can ask me later. Research has shown that eggs that come from follicles with optimal blood supply and optimal oxygen content have a higher fertilization rate and higher developmental potential and improved IVF outcomes. So more blood supply, more oxygen is helpful. We also know that the blood supply to the follicles in older ovaries is reduced, meaning that those eggs do not receive optimal oxygen and nutrition, which may be one of the contributing factors to the fact that they have poor egg quality. So unlike chromosomal integrity, this is something we can influence. So if we add to those two things, those two bits of knowledge, we know that acupuncture has been shown to promote growth of new blood vessels. And we know that acupuncture has been shown to specifically increase blood flow to the ovaries. So in summary, what we could say then is that the use of certain acupuncture point combinations, maybe stimulated with a gentle electric pulse, can promote the blood supply and the delivery of nutrition and oxygen to the follicles, and thereby hope to improve their potential to fertilize and create embryos. And the other way that we can improve egg quality is the idea that we discussed earlier, that we can improve its capacity to make energy so that it can impart this enhanced capacity onto the embryo after fertilization. Another thing we know from research is that those eggs, those oocytes, that consume more oxygen before fertilization, i.e. those ones that have got more active mitochondria and more active aerobic respiration, are the ones which form better quality embryos. We know that by the time the embryo reaches the uterus, now this is on day 5 or 6 if there's a blastocyst transferred, and day 5 or 6 in a natural situation, it needs not only good numbers of mitochondria but optimal mitochondrial function and ATP production via aerobic respiration so that it can succeed in implanting. So these are all aspects that we think Chinese medicine might be able to, where Chinese medicine can exert some beneficial influence, especially when the eggs are ripening. Okay, so what we can do so far, summary so far, is we know eggs with more ATP have a better chance of making viable embryos, and we know that the successful implantation of embryos has more to do with how much energy they have than with maternal age. So you can see now that we might be able to influence this thing called egg quality, even though we can't change the chromosomes. Research has shown that the mitochondria of older eggs are not so good at producing ATP, and research has shown that the eggs of poor responders to the IVF drugs have 3 times less mitochondria than those of good responders. These are the patients we would say have poor kidney gene. You might have heard that in some of the IVF clinics they've been experimenting with adding mitochondria from younger eggs from other people into older eggs to see if they can make better embryos. It's still controversial and experimental. Now, we've discussed the herbs already that we might be able to use. We're still on the same slide, Jack. Previous, yep. Watch when I do this. This is a long discussion because egg quality is the thing that most patients will come and ask you about. My IVF doctor has said that my eggs are poor quality and there's nothing can be done. I say, can you do something? Now, you can't make false promises, but this is something that we need to be researching as a group of specialists, and something that we need to think about is, can we help egg quality? And I'm discussing now all the reasons why we might be able to and all the ways we might be able to. So we've already discussed that there are specific herbs that have been shown in experiments to help mitochondria behave more like young mitochondria and produce more energy. And if there's mitochondrial research has shown if you've got more mitochondrial activity, you produce better embryos and better implantations. So maybe if we can load the eggs with these particular sorts of herbs and we can get better mitochondrial activity, we will produce more actively energetic oocytes and embryos. So, for the woman preparing for IVF with herbs and she has a kidney deficiency, i.e. her eggs are poor quality, she's not either producing very many in an IVF cycle, or they're not fertilizing well and producing embryos, or if they do produce embryos, they don't produce embryos with good viability, then this is one of the formulas that we might think about using. It's based on Gui Sha Di Wang 1 or Gui Sha Di Wang Tang, which is the most commonly used post-menstrual formula when we were doing our 4-phase treatments for kidney deficiency infertility. So our approach is going to be exactly the way we've approached trying to improve natural fertility, even though this woman's going to perhaps go back to the IVF clinic. Ideally, you do a formula like this for about 6 months with alterations along the way, but even if you've only got 3 months, you can apply some strong kidney jing and yin nourishment and some lifestyle changes. Hopefully you'll improve the responsiveness of the ovary somewhat. Now, if your patient is actively trying to conceive while she's preparing for IVF, you might want to follow the 4-phase approach that we describe in the book. So you'd be changing your formula depending on whether she's postmenstrual phase or ovulation phase or luteal phase. Often you find with patients who've been doing IVF, they've come to see you for a bit of help, and now they've given up. They've given up trying to conceive naturally, or they don't think it's likely to happen. You may choose to use a more standard approach where you just apply one strong kidney tonic for the whole cycle. This patient sometimes isn't trying to conceive naturally anymore anyway. Or you do both. You know, sometimes it's easier to just do one formula before ovulation, one after. But a lot of the patients we see who are preparing for IVF will often just take a preparing to conceive formula that addresses everything. So this is the formula that addresses everything. If you're just treating kidney function and egg quality, you could definitely choose this sort of formula. I mean, you'll modify it for your patient because there'll be small changes, but this sort of formula, which is a very expanded version of Gui Sha Di Wang Tang, because it reinforces kidney yin, yang and jing and calms the mind, is actually covering many, many bases. Usually during the menstrual period, however, especially if there's stagnation, but even if there's not, you can give another formula based on Dao Hong Su Wu Tang, which we will talk about when we talk about that blood stagnation category. It's very, very useful to use the period, use phase 1 as a time of flushing out any stagnation at all. Now, if with this particular formula, you can see we've got Gui Sha Di Wang Tang down to Bai Sha. Then we've got Dan Shen that will take care of a little bit of blood stagnation. Sha Ren is in there because most of the patients at this point who are taking this sort of formula are probably post 35. Chances are their digestion isn't so strong, so they'll need Sha Ren to be digesting a big dose of Shu Di. And then we've got a few kidney yang herbs in here because we need to support kidney yang and yin in an older woman or when the egg quality is not so good. And we've got Xiangfu and He Huan Pi to keep the qi moving and to calm the mind. And the rest, Buguja, Tu Si Tse, Swo Yang, Lu Jiao Pian and Zi Shu Ying, all to help the yang side of kidney function. Now, if there's also some yin deficient heat, which there often is in women in their late 30s, then you might want to add Zhi Mu and Huang Bai, and perhaps you take out some of the yang tonics. And if the spleen is weak, you might want to reduce the amount of Shu Di or increase the amount of Sha Ren. There's modifications you'll make according to your patient. But you see the thrust of what we're doing here? It's a large formula. It addresses all aspects of kidney function and what we're trying to do in terms of help egg quality. Preparing this patient for IVF with acupuncture. Most of this is the same as what you would do in a natural fertility cycle, someone trying to fall pregnant naturally. There's not a lot of difference here. These are very similar acupuncture regimens as are described in chapter 4 in the book. You take into account the patient's circumstances, the constitutional factors, and the different time of the cycle. But you can see here where this is just after the period, so we're balancing out the Ren and the Chong. We're encouraging blood production to replace what's been lost with the period. But with these patients especially, we need to emphasize development of kidney yin and kidney jing. So the kidney points are very important. Acupuncture on its own won't do it though. I think you do need the herbs as well. Again, this is very similar to what you'll find in Chapter 4. We still need to reinforce the kidneys in this person who's preparing for IVF. But if she's also actively trying to conceive while she's waiting to do her next cycle, which some patients haven't given up and they do still try, then you might want to use some points like this in her phase 3 around ovulation, just to help with all the movement that happens at ovulation time, but still really be aware of boosting her kidneys. Most of the points on this chart are more to do with what's happening in phase 3, i.e. movement of the egg around ovulation time. And then in the luteal phase with the patient with kidney deficiency, again very similar to what you would do in a natural conception cycle. If the patient is actively trying to conceive in the cycle when you're treating her, you can follow these ideas, same as the ideas in Chapter 4. If she's not trying to conceive, you can pretty much stick with the post-menstrual treatment, i.e. the one that's just building the kidneys, kidney, yin, yang, jing, and blood. However, if she has tried to conceive, you might want to do some points like this, where I've written first week there. That just means the first week after ovulation, because the week just before the period is the implantation window, and we tend to not use so many points on the abdomen at that time. This is another way you can support the luteal phase. Again, this is just from Chapter 4. If the woman is trying to conceive, then one of the ways you boost kidney yang, if it's not by boosting kidney, by reinforcing kidney yin, you can do it by promoting qi. So if someone who's got a spleen qi weakness, these are the sorts of points that you will think of using after ovulation if she's tried to conceive. And finally, another option for post-ovulation points where you build the blood in a blood-deficient person. But these are all notions that are very clearly described in Chapter 4, and these are the sorts of points you use if someone's trying to conceive naturally. Just to say at that point again, if someone's preparing for IVF and they're not trying to conceive anymore, then stick with boosting kidneys. You don't have to follow the cycle with quite the same sort of attention to detail.